Hi, I am Dr. Ratnakar. I am an orthopedician, come sports specialist. I am working in Continental Hospitals, which is in Gachibowli, Hyderabad. Today I am just giving a brief on the knee ligament injuries. This is one out of all sports injuries. If you take into account, the knee is the most commonly injured because the biggest joint, and knee is more prone to get injured because it is. If you hit a table also, it is the first joint which is the culprit to being injured. So out of knee there are so many ligaments. If you see we can diagnose so many injuries from simple sprain to the major ligament injury. So most commonly in orthopedicians, after an injury like a sports injury or a road traffic accident, the knee got sprained. Sprain is a common term. But beyond sprain is a simple ligament injury which can heal by itself within 3 weeks. The sprain is not properly treated, the pain may be long standing, and if you keep on giving tablets also, tablets is not the medication or end of the day. That is the answer for your sprain. It's a rest. Any ligament which is injured obviously demands rest. If you give proper rest, simple sprains will heal in 3 weeks. If you don't give rest, if you depend on painkillers, the pain will be a long standing one. And the most common injury in the knee is an ACL ligament injury. Out of so many ligaments, if you see the knee from the front, sides and back, there are so many things. The outer ligaments we can classify it as an outer ligaments and the main inner ligaments. The outer ligaments is very rare to get injured unless the knee got dislocated, is a major force or velocity or a road traffic accident there. So much of force is required to separate the two bones. That is rarely happens. In this location, so many ligaments will be torn. And other most common twisting injury. If you slip a staircase or your knee get twisted in volleyball or cricket while bowling or while taking a jump in a basketball, if you land on one leg, obviously one leg will stand protected, the entire body will twist out, obviously in opposite direction. Then some people might hear a cluck sound in the knee. Immediately they resume to the game. After the game, end of the day, they might feel swelling. After a couple of hours, or say after 6 hours, or maybe next day they will feel more pain and swelling. Because of the swelling is because of hematoma, there's a bleeding inside, slowly it will evolve and the pain will be more in the next day. So it is advisable to see the doctor immediately to know what had happened, because what type of ligament injury, how long the rest, and if it is curable or not curable to be decided. If it is a simple, obviously you can get a rest. If it is not simple, the doctor might ask you investigations made in the X-ray to rule out any major fracture or revulsion injuries, or an MRI. MRI can detect the major ligament injuries. No other investigation is better than an MRI to see the ligament injuries. So, most commonly injured ligament in the knee is the ACL. ACL protects us at 40 degrees of angulation. It gives us stability while getting down the staircase or walking on uneven ground. So anyone who injured the ACL, they don't have pain unless they have another associated injuries. Because ACL doesn't have any nerve supply or blood supply. So because lack of nerve supply, it can't heal by itself, and because lack of blood supply in the joint, it won't heal before it produces any pain. So any ligament in the knee, it won't heal automatically, because in the knee there is a joint fluid which will prevent from healing, and there won't be any blood supply, it won't be supplied with any nutrients to the tissues. So any tear inside the joint, take it granted, is a permanent tear. It depends upon your demands whether it is symptomatic or not. Symptomatic means whether you have a problem with that or not. Most of these ligaments inside the knee bone, they will give a locking effect, some locking or a buckling effect in the knee. You won't fall, but you might feel the knee is not stable. When you walk on the uneven ground, when you climb down the staircase, or when you want to have a sprint little bit for a short distance also, you will feel the knee is moving away, it's not stable. Sometimes the meniscus tear. Meniscus is a smooth cushion-like thing which protects between two bones from the cushioning. It gives a cushioning effect and prevents from wear and tear. If it is got torn or something, it will give a locking effect. Means the torn fragment comes in between two bones. It will get locked. The knee gets locked. If you dangle your leg for a few seconds, it will automatically that torn part will go back. You will feel normal. So for every episode, every lock-in or every torn episode, if you neglect it, the tear, take it granted, the tear is increasing. It is never subsiding. Every episode, the tear is increasing. So most of these things, if you, irrespective of age, if you want to stay active, your knee is bothering, you require to be done something. If ACL is torn, obviously ACL is an important ligament. It requires a reconstruction. It cannot sew it back. You cannot sew it back. It requires a reconstruction. Most of the ligament injuries in the knee can be tackled with arthroscopy. That's a keyhole operation. The amount of stay is 1 or 2 days. It's maximum 1 day. Or it's a daycare procedure. And daycare procedure. If you neglect the tear, and happens if you neglect and walk and if you do simple activities, obviously you are not falling back, but some other ligament is taking care of that. Obviously you are damaging another ligament if you neglect it. If the tear is beyond recoverable, obviously we need to plug it. So it is better to get an advice if any strong positive thing, torn part inside the body, inside the knee ligament, it is better to get it before it prevents further damage and it prevents from arthritis also. So important part of all these sports injuries is the rehabilitation. Rehabilitation takes a prime area in the sports injuries, and it is important to get back to your activities as early as possible. For every injury there is a different pattern, how do you exercise and everything. And for suppose if you take an ACL, the protocol is like you have to hop and walk or toe touch. You can't put your entire weight after the reconstruction. It takes a little bit of time. Like at 3 weeks, with the help of walker frame or crutches, you have to offload your weight. Walk on the toes, tip toes. After 3 weeks, you can completely put your weight. But getting into the sports or jogging, it takes 9 months to 1 year. So remember that it is not as simple. To get back its strength, it takes a little bit of time. In the meanwhile, you have to strengthen your quadriceps muscle. There's a lot of physio you have to do that. And meniscus depends upon if it is beyond recoverable. Generally, we do a meniscectomy. We have to remove the part which is torn, a irreparable thing. Then you can walk immediately next day, walk in, walk out operation. Most of the times we don't remove the meniscus, we try to resuture it, give the normal anatomy back so that you will feel normal knee. So if you come early, if the meniscus injury is suspected, the result is entirely different. You can get back to your activities as previously, your knee, you will feel as previously as it is. So it is important that the decision making is important, whether what is the extent of injury, how much you can do that, and how much your suffering is from that, whether it's curable or with the physiotherapy it will go, or you require any intervention. This is the important part. The initial part is very important. Don't never neglect any injury. Thank you.